Sign up with the largest community of Catholics online. Meet new friends, chat, post pictures and videos, make and receive audios and video calls, interact with lots of priests and religions. Download the app from Google Play Store.
Good morning, ladies and gentlemen. My name is Comfort Idu, and we are live at the National Hospital, Abuja, for the celebration of the World Stroke Day. And the theme for this year is "Don't Be the One." The associations and the foundations are here to make their support, to lecture people on how to prevent stroke. So please stick around with us while we take you through the tour for today.
The month of October is considered the World Stroke Month by the World Health Organization. The World Health Organization and other agencies across the globe set aside this month to create awareness and teach preventive measures against stroke, as well as provide relief materials to the victims. This year's event was tagged "Don't Be the One." Nigeria took part in observing the World Stroke Month, which kicked off in Lagos with a grand launch on 1st of October 2019. Several events, walks and lectures were held in several states, with a grand finale that took place on the 29th of October 2019 at the National Hospital, Abuja. The program commenced in the early hours of the morning with a walk around the hospital premises, sensitizing and creating awareness of stroke.
See your doctor. To have stroke. Don't be the one to have stroke. Don't be the one to have stroke. One heart prevent stroke. No alcohol. Prevent stroke.
In an interview with Ogwike Timothy, co-founder of Acha Foundation, he opined the reason for the World Stroke Day.
My name is Ogwike Timothy. I'm the co-founder of Acha Foundation, organizers of the Master Stroke Project.
Okay, so what's this year's theme? Today is the World Stroke Day celebration.
Yeah, today is the World Stroke Day celebration. The theme for this year is "Don't Be the One." Okay. Yeah, which simply means don't be the one to have stroke. You know, one in out of every 4 families is expected to have stroke. So the best way, we don't believe in curing, we believe in prevention, telling people on how to prevent stroke. Yeah, and to get around the effects of having a stroke. So, and that's why we are in collaboration with a lot of SSOs today. By SSOs, I mean stroke support organizations, general hospitals, the geriatric department in general hospital, and some other health organizations.
So what inspired the movement?
Well, for us, for Acha, the loss of our dad inspired us. You know, we are passionate about it. We lost him in such a way that we never expected. He was still a young man and he had stroke for 8 years. Yeah, and at the time he had his stroke, we had little or no knowledge about stroke at all. So, you know, when it happened, it came to us like a surprise, and we were like, is this spiritual, or is it something we cannot just, what kind of health situation is this that we don't really know anything about? So, you know, from taking him from one hospital to the other, and unfortunately, our health providers then really didn't know much about stroke. From one hospital to the other, even up to like, what do you call it, the traditionalists trying to say, okay, you can take herbs, you can do that. But while all this were going on, the situation was deteriorating. Okay. So it was that bad.
So since you started, would you say you've made great impact?
Significantly, we have, by creating awareness to the general public, communities, villages, towns, cities. We've been to several states and cities in Nigeria, and also we are also members of the World Stroke Organizations and also African Stroke Organization. A whole lot of SSOs are into this. The awareness is very, very holistic and all-encompassing, and we are glad to be part of this.
Okay, so do you think there's more work that needs to be done as regards stroke?
The work has not even started, if you ask me. We need the government support, we need individual support, we need private organizations to help in creating this awareness, to drive home, just the way HIV was driven. And I think now Nigeria is one of the least country with HIV victims. So that is the same way we want to spread this message across communities in Nigeria, across communities in Africa, and across communities in the world, so that this epidemic can be reduced drastically to the barest minimum.
Mrs. Florence Mbogu, Stroke Ambassador Team Leader for Stroke Action Nigeria, elucidated the theme of the year.
My name is Florence Mbogu from Stroke Action Nigeria. I'm the Stroke Ambassadors Team Leader for Stroke Action Nigeria.
Okay, so the theme for this year is Don't Be the One. What brought about the theme? Like, what was the inspiration for the theme this year?
The theme focuses on prevention this year. And prevention has to be personal. It has to do with you as an individual. And you need to know what to do so that you don't have stroke. And that is why this year's activity is focusing on knowledge, awareness, is focusing on risk factor assessment, and in addition there's an app the World Stroke Organization has approved that we are testing to know people's risk factors, and this will give them their status of risk factor in the next 5 years or 10 years, and this actually will influence action in them and arouse their interest to begin to ask themselves personal questions. What do I really do not to have stroke? The team says, whenever you are thinking of stroke, when you think about stroke, think prevention. And that prevention is what you will do personally to yourself. And we are bringing it to that level so that every individual will know that he has a responsibility to himself, to his health, and what to do. We're going to teach them today.
A physician and neurologist, Dr. Uzo Ugochukwu Ojukwu, delivered a lecture on stroke, causes, and preventive measures.
When oxygen is not taken to the brain can die, and that's what we call a stroke. There is also something called a TIA, which is a transient ischemic attack. In that situation, the symptoms resolve, where the blood flow comes back to that part of the brain, but there's no permanent damage to the brain. So the main signs and symptoms of a stroke is that sudden onset. You can have paralysis, numbness of the brain, of the face, arms, and legs. Basically, the types of stroke that you can have, this type of stroke symptoms, depends on what part of the brain is affected. The person may seem confused, have difficulty speaking or understanding speech, lose their vision, have double vision. It just all depends on what part of the brain is affected. So a stroke, you know that the brain is very important. You need you to walk, you need to communicate with people, your loved one and support system. So it's very important to know these signs because it can definitely impact your quality of life. You can also learn to spot the signs of the stroke quickly. Looking at D-class is a way to remember it. Loss of balance, severe headaches or dizziness. E for loss of vision, facial drooping, arms, weakness in the arms or legs, speech impairment, where you can't get your words out, or it comes out as nonsense, or you can't even get anything out at all. Our gender, our family history. When someone has family members that have had stroke, you are all at risk for more strokes. Your race, our race is black, we are at the higher risk compared to white people and other races. Our genetics, these are things that we have that we can't change. But there are things that we can do to make a big impact to reduce our risk of having more strokes. Addressing hypertension if it's there. We are going to be screening for that today. Looking at your cholesterol level, what we call dyslipidemia, checking for signs of diabetes, smoking, makes a big impact in multiple things. Using drugs and alcohol, and then having heart disease can also predispose you to having strokes. Your diet, what you eat can make you have strokes. If you're inactive and obese, those are also additional risk factors for stroke. And then if you have sleep apnea, which is a condition where you don't sleep well at night and you keep stopping your breathing while you're sleeping.
In an interview, she opined that the treatment of stroke has greatly improved with the help of experts, but the main focus should be on preventive measures.
So far, I think there's a lot of promise here. We have a lot of good physicians here within the internal medicine department. They work hard. They've been doing a really good job. But again, with stroke, the main focus can be with prevention because the treatments are very limited. We don't have the infrastructure necessary to do all the acute treatment for stroke, but we try to prevent and reduce their risk of having more strokes.
Okay, so what advice do you have for people at home who are not part of this meeting today?
I think it's very important to be cautious of your health. Number one, making sure that you watch what you eat, because the way you take care of your body It's also going to be in accordance with how your body functions. So if you don't treat your body well, your body will not be good for you. So make sure you watch what you eat, try to exercise, get at least 30 minutes of moderate activity or 15 minutes of more rigorous activity every day, or also try to do some more physical activity with your family, with your friends, but just try to engage in some level of physical activity. Make sure you know your health risk. We talked today about blood pressure, diabetes, high cholesterol. It's very important to know those things because those things can make a big impact in your life if you take care of your body very well.
In an interview also with Professor Boala, a professor of neurology and head of Neurology National Hospital, Abuja, he orated the involvement of government in fighting stroke, though he said a lot still needs to be done.
Well, there's been a lot. The Federal Ministry of Health has organized the Nigerian Stroke Action Group, which has collaborated with Stroke Action UK, Stroke Action Nigeria, and the Nigerian Stroke Society. The awareness is coming on, not as it should be, but hopefully if it's maintained at this tempo, particularly with participation from the Federal Ministry of Health, it will go a long way in making people aware of the risk factors for stroke and the preventive measures that need to be done, like managing high blood pressure and a healthy lifestyle, not smoking, not drinking, regular exercise, and keeping the weight down. A lot needs to be done because the funds given for the non-communicable diseases in the Federal Ministry of Health is very small. We know government cannot do it alone, but they need to show more effort in combating this disease, which is the second killer actually globally. And even in the low-income countries, it competes with HIV in terms of causes of death. So we would like to see government to fund it more and take more serious action.
He also outlined the statistics of stroke incidents in Nigeria.
In Nigeria, you find that the stroke cases are quite many. Here at the National Hospital, we admit virtually every other day 2 to 3 patients with stroke. And you could imagine what's happening in the private hospitals, government hospitals. Some may not even reach hospital. They die at home. So the problem is big, it is.
He ended with possible solutions to prevent stroke since it is not yet curable.
Technology for now cannot actually cure stroke like you treat malaria. But the good news is 80% of people with stroke have high blood pressure. And high blood pressure is the easiest diagnosis to make. Anybody can measure it with a digital sphygmanometer. And there's drug to control it. And we know if you control the blood pressure, the stroke is prevented. So it's preventable just by looking at blood pressure and other risk factors like diabetes, cholesterol, smoking, drinking, etc.
The event got to its peak with a checkup session. The attendants were given medical checkup by specialists and were also counseled. Some of the tests carried out were the HBP, weight, height, and BMI.
Very fine, as you can see.
The participation of people really responding?
Yes, I can say they are coming, gradually. You can't really see a large number of people at the same time. They're just working one at a time.
I'm Dr. Stephanie, and I'm Dr. Salama. So far, it's been good.
And the turnout is good?
Yes.
So you have, they think there are so many people against
Well, so far, not bad. We haven't had anybody at high risk, which is good because most of the people we've met, they're taking care of themselves, they eat healthy, they exercise a lot. They are aware about hypertension and diabetes and everything, so yeah, I think that's fine.
My name is Moyo Aya. I'm the founder of IDH Stroke Awareness Foundation. IDH Stroke Awareness Foundation is a non-profit organization set to create a consciousness of stroke and to also enlighten and educate people people about the preventive measures of stroke and the risk factors they should watch out for of stroke, and also to encourage stroke survivors that they can live a better life after stroke.
Okay, so have you been impressed with the progress so far?
Yeah, it's been amazing. The positive response we've been getting from people is actually motivating us to do more, because we really want to do more. We just started this year, 2019, and today is 29th of October, and it's World Stroke Day. And we're partnering with Acha Foundation, National Hospital, Ministry of Health, Stroke Action, and GAN to celebrate this day. We actually started celebration from 1st of October. We had an event in Lagos at Ikotun. It was the stroke clinic. We also had one on the 26th at Ogudu, which was stroke empowerment. We also had another stroke clinic at Gariki Market. All this is just to educate people about the preventive measures of stroke and the symptoms and signs of stroke. And according to World Stroke Organization, the theme for this year is Don't Be the One, because 1 in 6 people worldwide will have a stroke in their lifetime. So we are trying to reach out to people and to educate them about the preventive measures of stroke so that they won't actually be the one.
Okay, so what would you have to tell people who are not here today?
Okay, so I'll tell people that were not here today that they missed a lot. Anyways, I forgot to mention that what actually inspired me to start this organization was the mysterious personal experience I had with my mom in 2010. And I had the insight that if myself and my sister were aware of the signs and symptoms of stroke, maybe we would have been able to prevent my mom from having stroke, and she wouldn't be left with the physical and mental impediments that she lives with now, because my mom is a stroke survivor. When she complained of fatigue, if I was aware of what I know now, we would have probably rushed her to the hospital, and we would have actually caught stroke on time and wouldn't have left her paralyzed on her left side and the speech impediments. I would advise people in the house that they should please watch out for these signs, symptoms and signs. If you have a long-term headache that wouldn't go, if one part of your body you can't move it, and if you have a slurred speech, I would advise you to go to the hospital immediately, because abroad they tell you to call 911, but we don't have that kind of facility here.
Dr. Oyakire, a consultant neurologist at the National Hospital Abuja, gave an advice on preventing stroke.
Stroke prevention starts with a lifestyle modification. When we say don't be the one, we mean because of the prevalence of stroke. It's quite high in our environment because, one, being blacks, we're already predisposed to hypertension. And we've started adopting certain lifestyle trends here that are prevalent in the West. Domino's, SFC, KFC, and now with the advent of the internet, most people sit around all day. We're not really that physically active anymore. So when we say preventing stroke, we're talking about modifying all these lifestyles. Eating healthy, exercising regularly, cutting salt from your diet, and obviously checking your blood pressure as regularly as possible.
The attendees equally expressed their gratitude and encouraged everyone out there to go for a regular checkup.
Well, they have done a wonderful thing. This is what we are liking in the country. So I urge, many people should copy them, so that at least if we are taking bit by bit, in all these kind of elements, the enlightenment will go a long way to save life. Many lives could have been saved if we have a lot of this kind of program. So I would say kudos to them. They have done a very wonderful thing. It's something of very good. Now one should be here to at least assess the risk factor of a stroke. The good thing is that you will be enlightened on how to take care of yourself, and definitely one will do it if he likes himself. So I'm so excited with what had happened to me today.
Really good, because a lot of us, particularly myself, I don't take time to check all of this, and when I saw my weight today, I was wondering, is this me? So yeah, thumbs up. Thank you so much for this privilege. I'm really so happy I was part of it. God bless you. I would say we should take more efforts to be more proactive with our health. A lot of times we just go around it until there's a stroke, until you just hear you are hypertensive. So most people do not know their hypertension, we don't know the cholesterols and all of that. So I think it's important everybody takes it seriously and begin to know our health status and check more frequently.
I'm very, very happy because now you can see I'm knowing my own weight, I'm knowing everything about myself now. It's very good. I like checkup. You need to check up every day, every time, you'll get it. It will help you, and they said early detection saves life. Even if I'm having any problem, I can easily solve it. I can easily, the doctor, they will advise me, they will tell me what to do.
Sign up with the largest community of Catholics online, meet new friends, chat, post pictures and videos, make and receive audios and video calls, interact with lots of priests and religions. Download the app from Google Play Store.